Thanks for staying with us. So, Nigeria has one of the world's highest maternal mortality rate, with close to 1,000 deaths in every 100,000 births. Joining us on the show is a public health practitioner and the program coordinator of Saving 1 Million Lives program for Result, and also the child health coordinator in the Lagos State Ministry of Health, Dr. Muzeedat Erinosho. Welcome to the show, madam.
Good morning.
Good to have you back.
Oh, my pleasure.
We enjoyed it the last time, so we're happy you're back again.
Thank you so much.
So this issue of maternal mortality, almost year in, year out, we have to have this conversation.
Okay.
Has there been any improvement, would you say, in the efforts the government is making to reduce this rate in Nigeria?
Thank you, Muriah, for that question. There's been a lot of improvements on the part of the Lagos State government. As we all know, the Lagos State government is actually committed to improving the health-seeking behavior of the citizenry. And part of the initiative that the Lagos State government came up with, precisely in 2007, is the Maternal Newborn Child Health Week. Now, in Lagos State, we commenced in 2007, basically to ensure that women, children, as well as newborn, actually come to the health facilities to access care. Because we realized that there's a high patronage of women with the traditional birth attendants. Yeah. And we know how people will go to the TBs. But what we are saying is let the traditional birth attendants be registered with government, such that they will be able to know their limits. And what are their limits? For a woman that comes to their center, comes to deliver at the traditional birth attendant's place, and this woman starts bleeding, and the woman that is supposed to have delivered within a pace of 6 hours has not delivered. So those are telltale signs for this TBA, the registered TBA, to know that I need to refer this woman. These are all measures that government had put in place to ensure that come and register with government. If we're registered with us, they're going to undergo some form of training, training for them to know the danger signs of pregnancy. There are key danger signs for a woman to actually know that, oh, I think there's a problem with this pregnancy. One of them is she starts having severe headache, she starts having vaginal bleeding, and she basically has a prolonged labor. She doesn't deliver on time. So Lagos State government now came up with this initiative in 2007, which is the Maternal Newborn and Child Health Week, basically to give women and children the opportunity to access health care. But we now realize that, then it was actually tagged the Child Health Week. So in 2010 precisely, the Federal Ministry of Health also adopted the Maternal Newborn and Child Health Week. It's a biannual event whereby you have women bring their wards to the health facility. Presently in Lagos State, we have about 212 primary health care centers in Lagos State. And there's none of this PHC that you get to that you will not be able to actually access maternal, newborn, and child health care. Now, we now realize that the adolescents had been left out. The adolescents are 10 to 19 age group. And this is a very vulnerable
What do they
group.
have to do with
Yes, because we realized that during the heat of the COVID-19 pandemic, there were a lot of reported rape cases. And as we speak, we had over 3,000 reported rape cases in Lagos during the heat of the COVID-19 pandemic. So, and we now, the adolescent component was now integrated into it because we felt the adolescents are young adults. The way you will talk to a 3-year-old toddler, you will not talk to an adolescent like that. They need to be respected and they need their privacy. So Lagos State, in its mind, actually came up with some adolescents and youth-friendly centers. These centers basically are for those adolescents to come to those facilities to access care. If they go to our regular primary health care centers and they see maybe the mother of, a friend of their mom actually sees them in those PHCs saying, oh, Kilo HMB, you've come to access family planning services, they are embarrassed. They are young adults, and they actually should be given that respect. So Lagos State now actually came up with some adolescent and youth-friendly centers where we have some designated sites of these, we call them the ARS centers, where they can actually come there. They get information as regards family planning, as regards abstinence, as regards, okay, yes, you want to have sex, but it must be protected. We realized that during the heat of the pandemic, there were a lot of unwanted pregnancies. Most of these adolescents were victims of rape. And so the Lagos State government about 2 months ago also opened the Idera Sexual Assault Center. This is actually in General Hospital Erinosho, where basically victims of rape, samples will be taken from them, they take their specimen and they take it for forensic analysis. And the essence of this basically is for them, we're now saying, oh, even beyond you coming to those centers, there are actually a hotline that has been designed, it's a toll-free line, which you can actually con within the confine of your home. It is 08000 3333. So with this number, any adolescent that has been victimized, has been sexually abused, emotionally abused, because there are different forms of abuses. We actually focus more on sexual abuse. But emotional abuse, physical abuse is all there.
Okay.
Yes, ma'am. So now that you mentioned adolescents, I'm quite interested because I realize that a lot of young people do not understand how to take care of their bodies, which leads them to have infections that may end up to lead up to infertility by the time they get married and are ready to have children. So in this plan for adolescents to have somewhere they can come in for their privacy, is there a form of training on how they can better take care of themselves as women?
Yeah, thank you so much. We have, in the Adolescent Youth and Friendly Centers, we have about 6 centers in Lagos State presently, and we actually plan to scale up more of this. So we have counselors in these centers that are actually training the adolescents when they come. They train them, one, on their health, their eating lifestyle, because you realize the girl adolescents wants to be fit and trim. And they're actually picky eaters. They pick at food, they eat junk foods and all that. So we have counselors that have been trained that will actually train these adolescents when they come to these centers, and also on their menstrual hygiene, because it is very key. For most, I've been to a community where basically it was their first time of seeing sanitary towel. Wow. And they actually realized that when we asked them, what exactly do you use? And they said, we use cloth. Yes, that's what they have. That's what they can make do with. But we need to actually let them know how to take care of these things. Because hygiene is very key, especially for the adolescent girl child. Because we realize that if they are not, they don't actually ensure that they maintain good personal hygiene, it can actually result in pelvic infection, which can result in infertility later in life when they start having children.
So how many of these centers do you have around Lagos?
We have basically about 6 adolescent youth and friendly centers. We have in Elo Lagos in Lasuf. We have in Songo PHC in Agege. We have in Akere Primary Healthcare Center in Ajeromi Felodun. We have in Ogudu PHC.
Do you tell secondary school students that these things are available? Do they know?
Yes, they do, because we actually do peer education in secondary schools. And they actually are aware of these centers. Not just public schools. We have engagement with private schools as well.
Okay. I wanted to ask something. You said if you're one of the causes of child mortality, when you're having birth mortality, is the long labor. How long must the labor not be?
Okay. When you have labor that is actually prolonging, a woman goes into labor now, and you expect her, oh, she actually came into labor at about 6 a.m. And I'm expecting this woman to have delivered, good or take, within the next 6 hours. You expect her to have delivered if she's able to pull through. And we realize it's actually for those young moms. That is the teenager who is getting pregnant for the first time. She doesn't know the wherewithal of how to take care of pregnancy because she herself is a child that needs to be taken care of. So we now realize that once they are having these signs, the woman keeps going, is in labor, there's so much discomfort. And she cannot pull through within a pace of, within 6 hours. We don't even let it get to 24 hours. Because one, the child will be distressed, the baby will suffer in utero, and when the baby comes out, they come up with perinatal asphyxia, meaning this baby will not cry after birth and they start spanking for those centers where you don't have a skilled birth attendant. That's why we're saying for every delivery, we must ensure there's a skilled birth attendant. And who is a skilled birth attendant? A skilled birth attendant is that individual that has been trained on taking delivery of the newborn. So we're now saying this TBA, yes, we know how people will go to you, but for crying out loud, try and integrate and get engaged with government. If you are registered with government.
Can I ask you a question? You see, when we bring all these Lagos State people, Lagos State is Lagos State. We know Lagos State obviously is working to some extent. Are you partnering with other states? I mean, is there a group where you're talking to your counterparts across the country, where you are sharing knowledge, you're sharing expertise, you are also volunteering your time and knowledge to these other parts that need your help even more than Lagos State does?
Thank you, Morayo. Lagos State, as we all know, good thing you said when you bring us on air, we say so much. But basically, we do a lot of partnership with other states. They take a cue from us. Presently now, we have the Adolescent Youth and Friendly, Youth and Sexual Reproductive Health team. They are actually having a workshop presently in Sheraton where you have youths have actually come to engage us in the ministry, saying, okay, Lagos State now has, since you have an Adolescent Youth and Friendly Center, you've given us an avenue for us to actually air our minds, our concerns. So we had other states there that is actually collaborating with Lagos State to see to actually, look at the template Lagos State had adopted and see what they can do in the other states.
Yeah.
So it's a key stakeholders engagement that they actually started on Monday. They started yesterday, and it's going to be a one-week event that will run through engagement with other states to see what Lagos State is doing that they can take a cue from. Fantastic. And they can now actually do a model in their state as well.
I had an experience that I think discourages people who are using the traditional birth attendants from accessing, during referral, accessing proper health in the, the recognized government hospitals. So there's, according to them, and I saw one, if you're not registered at that, let's use a maternal and child hospital, one of the specialized ones in Lagos, for instance, and you're not taking your antenatal clinics there. When you're referred from a TB, when you come there, you're made to pay higher. So let's say the normal required amount is about 20,000 plus for a natural delivery. When you're referred there, you're not made to pay the cost of registration inclusive. So when the words now spread around that, you have to pay double. And if you're unlucky and you had to become a CS case, you're also made to pay for that as well. So it continues to increase the money, and this discourages mothers. This is a candid. So is it a fact? Is it still the status quo? Because I had that experience 4 years ago. And is there anything you're doing to do that to reduce the cost so that people are encouraged during the referral to obey the referral?
Care. Thank you, Nima. Basically, we had this challenge previously, but it was something that the populace raised an eyebrow about, and we felt, okay, there's a need to look into this. Yes, even if the woman is not registered with the health facility, and she's gone to a TBA, she now had a complicated labor, she needs to come to her PHC. Whether she's registered or not, the primary health care centers will take them, and the secondary health facility. Because the important thing is we want to ensure that you've saved the life of the mother as well as the baby.
And cost
is taken, so basically it's being taken care of.
Let me take this call from Additional. Additional, are you there? Hello?
Yeah.
You're live. Go ahead, please.
Okay, thank you, Morayo. I want to say categorically that we appreciate you guys, and you are doing more professional job.
Thank you, sir.
Very investigative journalism. And I would like to talk about the woman about paternity. But I want to say it to everyone in Nigeria. We are not fair to Nigeria. The legislators, they are not doing their own the way journalism are doing their own in our country. It has to be investigative, legislative. He can't sit in Abuja and be talking about something in his locality for people that even voted for him, that made him know the road to Abuja. He can't sit in Abuja and be saying that. And we're not fair to our people and the country we belong to. It's not fair. That's what I want to say about it. It's something that everybody can say that. You're not telling us about the materials. You're telling us about workmanship. You're telling us about VOK. You don't even know the scope of work. It's not fair for you to be talking like that. It's something that is, in fact, we that were lead.
Thank you, Mr. Additional.
Thank you. Why are you eyeing me on national TV?
I'm not eyeing you.
I didn't see that coming. Yeah. So I wanted to ask, when you said that you have advised, the traditional birth attendants to try as much as possible to register with Lagos State government, and so that if anything happens, they can easily refer.
Yeah.
But sometimes, after having the child, something like the placenta refuses to come. At that point, do they have, for those who have registered, do they have the mechanism to transport that sort of woman to any state or primary health care center?
Okay, I thank you. I said earlier that for those that have registered with government, they are actually been trained on the danger signs of pregnancy. So what we're saying in Lagos is we don't even want it to get to the level where the placenta is out. So there are key telltale signs that the TBA will see to actually know that, at this point in time, I need to hand off and send to the primary health care center. i.e., the woman gets to the facility, she gets to their TBA site and complains of constant headache. Even once the TBA see a vaginal bleeding, is an indication to refer. For the registered ones with us, they don't actually go beyond their limits because we don't want it to get to that point. What if it's in a rural setting where there's actually no device to transport that? So invariably, we ensure We ensure that those danger signs, for the trained ones, they strictly adhere to them. And once they see a woman come up with any of these danger signs, they are actually referred on time to the health facility.
Yeah, but you know that sometimes you don't see these things coming. You don't from the beginning.
Just happens.
And it just happens.
Okay. In instances like that, the closest, because they are registered, the closest primary health care center to that facility, they will have informed them. So there's good intercommunication between that registered TBA and the primary health care centers. Once that they don't get to the PHCs and they tell them, oh, you didn't register with us, we can't actually allow you to access care here. So there's that collaboration.
Dr. Muzeedat, I see too many unqualified, unregistered, so-called chemist nurses deliver babies in ways that scare me, because the situation you're painting, like Bisi was trying to explain, truly should not even happen. What happens in the secondary maternal hospitals, I know, is that you will see that side that the placenta is previa, or whatever they call
placenta previa.
So you prevent, you will not even touch.
Yeah.
But we see this.
And you are like,
what is your level of prosecution of, you know, this qualified practices happening around?
Okay, we have an agency that is saddled with our responsibility in Lagos State. That's the Health Facility Management Agency, EFAMA.
They're not doing
they are actually doing their best.
Really?
Yes, I'm sure it would be nice for you to actually invite the Executive Secretary of EFAMA so that she can actually shed more light on this. Once there's a reported case, they have their checklist. Even for a health facility to be accredited, there are criteria. But you realize that in the rural setting and even in the slum communities, you have a lot of TBA sites. You have chemists being used as delivery sites. That's okay, that's the only thing they can access. But we are saying, come, we want to actually reduce deaths of our mothers and that of the unborn child. So there's a need to actually have a structure on ground. And that is why Lagos State Government came on the Health Facility Management Agency that is saddled with those prosecuting process. So they go to those facilities, and once they see that you don't have the standard that is expected for a health facility to be put in place, they lock them up. That's why they bombard us at the Ministry of Health that, oh, yes, I have my papers, you don't have this and all that. But we just have to. If there's no prosecution on ground, people just do whatever they like, and it's actually putting the lives of this vulnerable group at stake.
Okay, for me, my own concern, I mean, might sound trivial, but I'm concerned about the aesthetics of these places. I mean, I always feel to myself, like, am I part of your target market? Because I go there and I'm like, I don't want to have my child here. It's not, it doesn't just attract people like, so what, is there anything the government is doing to make it more, you know?
I understand
for you now.
That's what I'm saying. I'm asking,
so you can't come and deliver in a place.
I would love to. Honestly,
gone are those days.
If you already have my children, I would have come to
maybe not
Are you referring not to the primary health care centers? Because initially we had dilapidated PHCs where you pass by and it's been overgrown with weeds.
Yes.
So it was during the time of the then governor, Mr. Babajide Raji-Fashola, that there was revitalization of primary health care centers.
Yes.
And you now have a situation where you get to PHCs and people are asking, is this a primary health care center?
I haven't been to one. The one I've been to is because that one I went to do injection. Is that what the PHC?
You got your COVID vaccine.
That's the PHC. I'm right here.
I won't deliver encouraged me to vaccinate my children. All of them.
I went there for my COVID vaccine. This one here, Aladelola here.
Okay, and when you got there,
Lima is not sympathetic to things like that.
But you got your COVID vaccine.
I used them. I still visited the one in Iba. I visited the one in Iba for June 12 weekend. Just deliberately took my sister-in-law there, and I was able to, and I was just, fortunately for face mask, nobody recognized me, and I observed everything.
The reason why I took my COVID vaccine,
I was nice.
Were you well attended to?
Yes. You see, they were professional.
There was delay. Because they wanted to give an injection.
Lima, they were professional. They did their job. They didn't look at anybody's face. They were there to work, and I appreciated that. But it's just that
the scenery,
Lagos State government keeps trying, keeps revitalizing, upgrade of facilities. It's a continuous process. Just to wrap up our maternal, newborn and child health care week was actually commenced from the 12th of July to 16th of July.
Is it free?
Yes, free maternal child health care services. And the flag off is going to be by the First Lady of the State on the 9th of July, Her Excellency Dr. Mrs. Ibijoke Sanwo-Olu. So we are imploring all mothers to please bring out your babies to get immunized. The adolescent will come. We also have women need to do cervical cancer screening. Yes, eligible children under 5. To get vaccinated. And there's also cervical cancer screening. This basically will be done. We have about 40 PHCs that have been designated for free cervical cancer screening.
You seem to love what you do.
Yeah.
It's my passion.
Well, you didn't mention
you can see
whatever center for Amodofin. I heard Ajeromi. I didn't hear Amodofin.
Ajeromi in Akere PHC in Ajeromi. I'm a word of it, they're working on that. We're working on the one in Bogije. So we'll get there. Don't worry.
I heard that the governor's wife is very involved in the Ministry of Health. Is that correct?
Yes, she is. You know, she's a medical doctor, so she has that passion and the drive.
She doesn't talk to us. She doesn't, you know,
don't worry. If you invite her Excellency one day, I'm sure she'll find her. No problem. No problem.
Excellency's wife.
You didn't let me read tubes.
Exactly. They didn't let you. They didn't let me ask
questions. You're inviting the first lady.
Because of that, they were talking to him.
Leave our legislator alone, please.
They were talking to him.
Listen, I have to wrap up. Let me wrap on that. You see, this is a lawmaker. Yes, we appreciate our lawmakers to do better. And because he wants to do better, that's why he came on the show. He volunteered to come on the show to say his own side. So let us not chastise him. However, we're giving him feedback that would rather him be home to inspect.
Feedback.
That's feedback. So let's not find a way to make it.
Have
a lovely day. We'll see you tomorrow. Leave Mr. Kwatase alone. We'll see you tomorrow. Tomorrow is Wednesday, Abi. Bye-bye. See you tomorrow.